we ask it for to be access to. So we have the data from health system management system, which is available from the facilities we have access to. Then we have the HS2, the patient level, which collects the different data from TB, red process data. We have change COVID data, which are the individual, which are collected individual data, individual level data. Then we have treatment care. This is the huge data set, which collects routine HIV services data from testing to treatment, and is part of the National HIV/AIDS Care and Treatment Plan in Tanzania. With this one, we have ethical clearance to use the secondary data analysis, which we obtained almost 5 years ago, and we annually up to date it and use the data from that area. Then we have access also to National Survey Database. Of course, these are public variable research for research purpose. So we usually also have access to it whenever we have the interest to look into the data. We look into them to see how we can use the data and use it. So part of the surveillance, we have been involved, like the big study which is ongoing, it's on drug resistance on HIV. We try to collect the data and try to estimate the prevalence, especially when it comes to data on drug resistance to HIV. The aim is to promote especially the new drugs which are coming now. Like now we have the DTG. That's why this study is ongoing. Then we have the study on we are surveillance using the distant infections using the test algorithm for personal new diagnosed HIV infection in Tanzania. This is an ongoing study. The part of the implementation research, we have the data. We are looking now. We are ongoing study doing on the experimented some of the country to look at the context of DTV again, where to have an objective to look towards the achieving the program performance, especially the third retention part of it, where you use the same data, Then we also going further. We are looking for the maternity waiting homes. It's part of the implementation research. We're trying to look the best way at the end. If you can see the magnitude and look forward, how can we increase maybe utilization and also accessibility to these maternity homes. And also, there's another ongoing. We look for unsuppressed HIV infected client, whom we are looking to determine their risk sexual behavior and the clinical outcomes at the end of the day, so as to promote the health behavior, especially when it comes to sexual part. Part of evaluation, of course, this is ongoing, and we have the ongoing now. We're doing the part of the midterm evaluation, outcome evaluations. Also, especially this, we are focusing mostly on HIV strategy, especially HIV self-testing and ERT coverage. This is the part we are trying to look for how far we have achieved when it comes to implementation. Otherwise, these are the several publications we have been done through, and it's cut across every wide areas. You can see we've been involved from infectious disease to the non-communicable diseases. So what we are looking forward in this data science, we look for to be able to enhance our efficiency, effectiveness, and also to bring the impact when it comes to program implementation, so that we have the expertise in a scientific way, so that we generate the good evidence. So with it, we are looking forward to networking and collaborating when it comes to data science, the capacity building, and enhance also data analysis and insight. We are talking of the big data. We have the huge data set, as I mentioned before. CTC database is a very huge data set from 2010, which is collected data on a continuous basis. So we are looking forward, especially we are not be able to dissect it, to be able to analyze it because of the huge data, because of certification of the data itself. So that's part of also we are looking forward. Also to come with innovation solution technologies. As I've said, we have much of the data, but it might need some kind of sophisticated technology to be able to use it appropriately. And also, as part of it, we have access to the funding and the resources. This is where we are looking forward in this forum. As I, thanks everyone for listening. Thanks, and back to you.
Thank you, Mr. Moka. So we're opening for questions. If you have any questions, contributions, please unmute and speak, or you can put it in the chat. Ms. Malka, what are you looking for in a partner? What kind of partnerships are you looking for?
Thank you. Thank you very much for the question. As I mentioned before, or from where we are and what we are looking forward, it's a partner whom we can build up together in a sense of building up a team where we can go beyond whether for the funding to work the team together and also expanding our portfolio in sense of what can we do to improve our implementation side. But apart from which, we also the partner we can have a wide sense when it comes to efficiency in whatever way, because as they've said, we have the data mine, but sometimes we face the challenge when it comes to technicality and also sophisticated way of using that data. So if we have the partner whom we can be able to work together, whether you use our data and also having the access to their accessibility, especially when it comes to technologies, that would be very useful and very looking forward to. Yes.
Okay, thank you. I think, Amy, did you have a question? I thought I saw your hand go up briefly.
Yeah, I just raised my hand. Can you hear me? Okay.
Yes.
Great. I just want to say thank you to the MDH presenter. I think I'm not sure how to pronounce your name, but yeah, I feel like we could be your partner at IntraHealth. So we are really like I have a PhD from Duke University working in big data and machine learning. So I'm presenting later today if you're going to come to the session in about an hour. But this is the kind of partnership that we're looking for, right? So if you can find funding to analyze your big data sets, we can work with you, kind of use the data, but train you on those approaches and have kind of a collaborative approach to using the data.
That's great. That's great.
That's awesome. That's awesome.
Yes.
And
your name again?
My name is Amy Finnegan. I'm going to put my email in the chat.
All right. All right. Great. Thank you.
Yeah, and Williams, if you can also put your email in the chat just in case somebody else would like to contact you later.
Sure.
Okay. And I see a comment in the chat from Mariam. I can't say your last name too, I'm sorry, Ramoni. And it says, she says, until everyone is healthy. That's a very effective line. This is the goal.
Thank you.
So, before we close out the room, are there any more questions or contributions? Okay, and Amy has a comment in the chat as well. She says, as IntraHealth, we have the capabilities to help build capacity in data science, big data, machine learning. We can't offer funding, but if you can have funding, we can contract together. So thank you all for the time spent here. We hope you enjoy the rest of the sessions. Thank you, and see you all in the main room. Wilmus, thank you so much for your presentation. And thank you,
thank you,
Dowd as well. Thank you.
Thank you.